So let's grab yet another CT scan from acute. I'm working from the office and from the office for a bunch of emergency hospitals. We have a lot of emergency CT scans to report. Let's grab the first one. This is a CT scan of the head of a 71-year-old male. Let me share the screen so you guys can see all that I see. It's downloading. It has finished downloading. I'm going to open up the images. This is brain parenchyma window. This is bone window. First row of the images is here. You guys are seeing as much as I can see. So this is what we have here. Let's check for clinical history. Why is this patient going through this CT scan? It says subarachnoid hemorrhage or subdural bleeding of some sort. So it's some kind of bleeding disorder of the brain, I suppose. So let's see what we have here. We have clearly a sinus disease. This patient has a very diffuse severe sinus infection. The temporal bones are fine, but there is sinusitis, acute and diffuse sinusitis. No signs of trauma, no signs of fractures. These are the maxillary sinus filled with anomalous content, anomalous material with bubbles of air and air liquid levels, which means this is acute, this is diffuse, this hurts like hell. So if the motive for the CT scan was headaches, I'd say we already had reached the diagnosis, but it isn't. So let's see the brain parenchyma. Those of you who are experienced have already seen the problem we have to report. I'm just rolling the images and letting everyone analyze calmly, with ease, enjoying the images to finally realize what's causing this patient any brain disturbances. So this is a quite preserved brain for his age. He is 71 years of age. This is a really normal brain parenchyma, not much volume loss. There are tiny spots of hypoattenuating lesions, which could justify a very mild microangiopathy, a mild microvascular disease of the white matter. I have to report that for sure. There is some calcification of the internal carotid arteries and of the vertebro-basilar system, which is very, very common in his age. The ventricular system, both supra and infratensorial, are fine. Fourth ventricle is fine. Brain pedicles are fine. lateral cisterns are kinda prominent, or kinda enlarged, but it's really common in his age. I can't really say it's pathological, but as you guys have noticed, there is an enlargement of the pericerebral space adjacent to both frontal lobes, and the attenuation is a bit higher in comparison with the fluid inside the ventricular system, which means this isn't just pericerebral fluid, it isn't normal subarachnoid fluid. This is most probably all the way from the frontal to parietal to temporal lobes on both sides. This is probably subdural chronic hematoma or a hygroma, which is a chronic fluid collection that no one knows where it came from. So in practice it's the same, and we might just say it on the report. So there is bilateral and symmetric fluid collections on the subdural spaces of both cerebral hemispheres. I have to measure how thick they are. This is 0.9 and this is maybe a bit less on the left. Oh, excuse me. So this is 0.8. So this is a usual cause of chronic headaches and loss of some neurological functions and worsening of dementia. Chronic subdural hematomas can be the cause of a bunch of weird, awkward, odd presentations of brain diseases, and in some cases when the neurosurgeon sees that it's necessary, they can even go through a surgery for drainage. I don't believe this case in such small subdural chronic hematomas. This patient will go through in kind of surgical intervention, but it could be done, it has been done, and it could be the case in a minority of patients. So let's just report it and get another exam. So let's grab a template. I have a template that already says this patient has atherosclerotic calcifications of the intracranial arterial vessels. I'm going to describe those tiny spots of microvascular disease of the white matter. Right here, a bunch of tiny spots. This is microvascular disease. This is gliosis, which is much easier seen on MRI, but we have to train our eyes to see it even in cases we only have the CT scan. So this is mild disease, nothing major. Let's just describe it. Tiny areas of hypoattenuation on the deep white matter of the brain, especially on the frontal lobes. And now we have to describe the subdural collections, chronic collections. Subdural collections. So I'm going to summarize the report. Subdural collections, chronic subdural collections could be hygromas or hematomas, and tiny areas of hypoattenuation, which are usually microvascular disease. And we are done. This exam has been reported and it's finished. So if you have enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. This one right here. Just click here and keep watching. Thank you so much for watching. Hit that like button and consider subscribing to the channel. Thank you so much, and I'll see you on another video.